Ever wondered why your cat has diarrhea? It's a question that puzzles many pet owners. Indeed, feline diarrhea is not a topic that makes for casual dinner conversation, but it's a common issue that many cats and their human companions face. It can be caused by a myriad of factors, everything from what your cat is eating to underlying health conditions. First, it's important to understand what we mean by cat diarrhea. Cat diarrhea isn't a disease in itself, but rather a symptom. It's defined as frequent, loose, or liquid bowel movements. Much like in humans, consistency is key when it comes to feline stools, and any significant changes could signal an issue. The condition can vary quite a bit in duration and intensity. It could be short-lived, lasting just a day or two, or it could persist for weeks at a time. The severity can also range from minor discomfort to severe dehydration and malnutrition. The key thing to remember is that diarrhea is often a symptom of an underlying issue. It could indicate anything from a dietary intolerance to a serious illness, so it's not something to be ignored or taken lightly. Knowing what cat diarrhea looks like is the first step towards addressing it. So, why does your cat have diarrhea? There are numerous potential causes. Let's dive right into it. One common reason is a sudden change in diet. Cats have sensitive stomachs, and a sudden switch from one type of food to another can upset their digestive system, resulting in diarrhea. This is why it's always recommended to gradually introduce new foods into your cat's diet rather than making an abrupt change. Food intolerances or allergies are another possible culprit. Just like humans, cats can be intolerant or allergic to certain types of food. This intolerance can cause inflammation in the gut, leading to diarrhea. Common food allergens for cats include dairy products, fish, and certain types of grain. Infections, whether they are bacterial, viral, or fungal, can also lead to diarrhea in cats. These infections often affect the gastrointestinal tract, disrupting the normal function of the digestive system. Parasites are another infectious cause of diarrhea. Common parasites that can affect cats include roundworms, hookworms, and Giardia. Some diseases and health conditions can also cause diarrhea. These include inflammatory bowel disease, hyperthyroidism, and certain types of cancer. If your cat has chronic or recurrent diarrhea, it could be a sign of one of these more serious health issues. Stress can also be a factor. Yes, cats can get stressed too. A move to a new home, the arrival of a new pet or baby, or even a change in routine can cause stress in cats, which can result in digestive upset and diarrhea. Lastly, certain medications can cause diarrhea as a side effect. If your cat recently started a new medication and then developed diarrhea, the medication could be the cause. Remember, some causes are more serious than others. If your cat's diarrhea is accompanied by other symptoms like vomiting, loss of appetite, or lethargy, it's important to seek veterinary care right away. Chronic diarrhea, or diarrhea that lasts for more than a day or two, is also a cause for concern and should be evaluated by a vet. Identifying the cause of your cat's diarrhea is crucial to determining the appropriate treatment. Besides the obvious, there are other symptoms to watch out for when your cat has diarrhea. Let's delve into these symptoms, and remember, recognizing them early on can contribute greatly to your cat's well-being. Firstly, you may notice changes in your cat's appetite. An affected feline might show less interest in food, or conversely, seem increasingly hungry. This can be due to the body's attempt to compensate for the nutrients lost through diarrhea. Another symptom could be vomiting. When a cat's digestive tract is upset, it's not uncommon for this discomfort to result in vomiting. If your cat is vomiting frequently, it could be a sign that their diarrhea is caused by something more serious. Weight loss is another symptom you should be aware of. Because diarrhea can lead to dehydration and malnutrition, your cat may start to lose weight. This can be gradual or rapid, so it's essential to monitor your cat's weight closely. Lastly, you might observe changes in your cat's behavior. Cats are known for their regal composure, so if your cat seems lethargic, agitated, or just not their usual self, it could be a sign that they're not feeling well. Now, while these symptoms may be associated with cat diarrhea, they can also be indicative of other health issues. That's why it's crucial to monitor your cat closely and seek veterinary care if these symptoms persist or worsen. You know your cat better than anyone else. If something seems off, it probably is. Don't hesitate to consult with a professional. Even if it turns out to be a minor issue, it's always better to err on the side of caution. And remember, diarrhea can be particularly dangerous for kittens, older cats, and those with pre-existing health conditions. In such cases, immediate veterinary attention is essential. Being attentive to your cat's symptoms can help ensure they receive prompt and effective treatment. Keep a watchful eye on your feline friend, and together, we can ensure they stay happy and healthy. Dietary changes can play a pivotal role in alleviating the symptoms. If your cat's diarrhea is due to a change in diet, reverting back to their old food can often solve the problem. Introducing new food gradually, mixing it with their current diet can also help their stomach adjust. Sometimes a bland diet of cooked white rice and boiled chicken can help settle their stomach. If dietary changes don't do the trick, medication may be necessary. Over-the-counter remedies such as kalinpectin can help to firm up stools. Probiotics are also a go-to solution, as they help restore a healthy balance of bacteria in your cat's gut, aiding digestion. Anti-diarrheal drugs can be used too, but it's essential to consult with a vet before administering any medication to your cat. Hydration is another critical aspect of treating cat diarrhea. Diarrhea can cause your cat to lose fluids quickly, leading to dehydration. Providing clean, fresh water at all times is a must. In severe cases, your cat may need subcutaneous fluids, which a vet can administer. While home care can be effective in many cases, it's crucial to know when to seek veterinary attention. If your cat's diarrhea persists for more than 2 days, if there's blood in their stool, or if they're showing signs of distress like lethargy or loss of appetite, it's time to take them to the vet. Your vet can run tests to determine the cause of the diarrhea and prescribe a suitable treatment. Remember, treatment will depend on the underlying cause of the diarrhea. It could be as simple as a dietary indiscretion or as complex as a chronic disease. So it's always important to consult with a vet to ensure your cat gets the best care possible. With the right treatment, most cases of cat diarrhea can be effectively managed. So rest assured, your feline companion can bounce back to their playful, happy self in no time. Prevention is often the best cure when it comes to cat diarrhea. Indeed, prevention is key and often easier than treating an already sick pet. Regular veterinary checkups are a fundamental part of this prevention strategy. These visits not only help in early detection of any potential health risks, but also provide an opportunity for vaccinations and general health advice. Keeping your cat's living environment clean is another essential preventive measure. This includes regular cleaning of litter boxes, which can be a breeding ground for bacteria and parasites. Also, remember to wash your hands often, especially after handling your cat's waste to prevent the spread of any potential diseases. A balanced diet is another crucial factor in preventing cat diarrhea. Cats are obligate carnivores, meaning they thrive on high-protein, low-carbohydrate diets. So, it's important to provide them with nutritionally balanced cat food. Avoid sudden changes in their diet, as this can upset their digestive system. If you must change their diet, do it gradually over a period of 7 to 10 days. Hydration is also vital. Ensure your cat always has access to fresh, clean water. This helps keep their digestive system functioning properly and can help prevent dehydration, a common issue with diarrhea. In summary, cat diarrhea is a common issue that can be caused by a variety of factors such as parasites, infections, and dietary indiscretions. It's essential to understand the symptoms associated with cat diarrhea, including increased frequency of bowel movements, watery stools, and changes in color or consistency. Treatment options are varied and depend on the underlying cause. They may include dietary changes, medications, or in some cases, hospitalization. But remember, prevention is always better than cure. Regular veterinary checkups, a balanced diet, and proper hygiene can go a long way in keeping your cat healthy.